There we go. So welcome to Toronto Data Workshop, everyone. Our guest today is from the University of Michigan, Rona Fang-Hu, and she's going to talk about predicting the unobserved, integrating something else, sexual identity responses in health disparity studies using machine learning and resampling techniques. So Rona is a master's student in the Michigan program on survey and data science. She has an undergraduate degree in psychology, and she has worked as a research associate and chief operating officer. And incredibly, for a master's student, she has presented papers at the JSM, which is the Joint Statistical Meetings, since 2022, which is an incredible achievement. Thank you very much for joining us, Rona.
Thank you, Rohan. Hello, everyone. My name is Rona Hu. I'm a second-year master's student in the Michigan program in survey and data science. So it's a unique program. It's a small educational unit under the Institute for Social Research. And I'm also an intern at the SSRS. So SSRS is a survey company. And if you are looking at those election polls, you will notice that we conducted election polls for CNN News. And this project I'm going to present is a joint work with my advisor, Dr. Brady West. Our paper uses machine learning and to predict the observed response category in the survey measurement of sexual identity with applications in examining health disparities. So I just mentioned this to Rohan. I presented this at the JSM 2024. So it was in August in Portland, Oregon. So I just had my rehearsal. Hope I can do a better job today. Okay, so let me share my screen. Okay, here we are. Oh, sorry. So this is the full title. I know it's super long, so I should have shown you guys this. And it's pretty, right? We have ISR, MPSDS is my program, and SSRS is my the company I'm now working at. So I still need to do this acknowledgement part. So this work is funded by the NIH to Dr. West, my advisor, and I also want to express my gratitude to my internship sponsor, SSRS, for allowing me to work on this project during my internship. So sexual identity is commonly measured with three response categories in surveys. These categories are straight, straight or heterosexual, gay or lesbian, or homosexual, and bisexual. So recent work has suggested that adding a fourth response category, which is something else, can improve the survey measurement of sexual identity. Furthermore, empirical studies have shown that surveys that do not include something else as a response category may produce biased estimates of health disparities by sexual identity with significant public health implications for sexual minorities. So we would like the best possible measures of sexual identity in a data set that does not necessarily provide them, but does provide a common set, covariate, consistent with data sets that's included the better measures. So here is the idea of this project. So basically, we are imputing the unobserved something else in surveys. So the way we think about the potential biases from the lack of something else response category for sexual identity questions is a missing data or omitted variable problem. So survey respondents whose quote unquote true response is something else would have to choose from the other three response categories if they answer the sexual identity question. So we want to seek to retrospectively impute something else back to this respondent. So how could we do that? We leverage a split ballot experiment in the 2015 to 2019 NSFG National Survey of Family Growth. In these waves, or to say years, some people might not use waves since it's not longitudinal data. So in this years of the NSFG, respondents were randomly assigned to two treatment groups. So the first group, or to say half of the sample, received the questionnaire that includes the sexual identity measurement of 3 traditional or common response categories, which are straight or heterosexual, homosexual, and bisexual. And we call the first treatment group TG1, like treatment group 1. And the other half of the sample received a questionnaire that includes something else besides the common 3 categories. So we call this group TG2, this half sample TG2. So what we should keep in mind, and I would say this is the nuance or punchline of this project, is that these 2 groups should be identical based on the split ballot design. And also our prior work shows that these 2 groups are otherwise social demographic measures. So we need to keep this in mind because this is the most important key to the whole project. Then we predict responses with machine learning in an innovative way. So our machine learning framework is unique in the sense that we use TG2, the half sample with a something else response category, as the training data set. And TG1, the half sample with 3 traditional or common categories, as our test data set. And we train model using TG2, the half sample with something else, and predict the 4 categories in TG1 that original didn't include something else. And we then compute revised estimates of health disparities based on these new predictions. So, oh my God, I forgot to show. Oh, wait, not yet. So we repeat the process using bootstrap resampling techniques to generate an empirical distribution of revised health disparity estimates. And we then compare the estimates in our model of interest to those based on the original forward response category training data set, which is TG2. So I know it sounds like a little bit complicated. We will review the framework again later, but I think a quick way to get the idea is that since this is split ballot design, so I mentioned that these 2 groups should be identical. So originally I thought I want to know who would move from the 3 categories to the 4th category, something else, if they had the option. And that's the start of this research idea. And in fact, it's pretty simple. So imagine the TG2, this half sample, is our population. And after we use this half sample to train the model and predicts the probability of each the probability of choosing each categories in our test data set, and we repeat it, we will get our sample, and then we can compare the sample estimates with population parameters to see how good or how bad our prediction is. So you can keep this in mind, and then we will go further. Like my advisor made this even more solid. So the aims of this study is to evaluate a framework for retrospectively constructing the something else category of sexual identity in existing data sets, build models to predict something else based on TG2, and see how the models behave on TG1 with the newly predicted sexual identity data as compared to the original TG2. and applied the models in other data sets to predict whether each respondent may have responded with something else if given the option. Okay, so this is the overview of the research. Data sets, we apply algorithms of reinforcement learning to build models, which is random forest, to predict the probability of choosing each category of sexual identity. The specific set of covariates can include the entire NSFG data, but in future efforts to impute the something else category of sexual identity in other data sets, we can restrict the inclusion to specific covariates of theoretical interest. And the covariates in this study encompass demographic, behavioral, and health-related variables such as age, education, marital status, sexual behaviors, and risks, substance use, and prevalence of STDs. So this here is a quick recap of the data we used. The NSFG conducts personal interviews with the stratified multi-stage cluster sample of households to gather information about family, fertility, and reproductive health. And one randomly selected age-eligible, in other words, 15 to 49 years old individual within a sampled household was interviewed. The public used an SFG sample of 9,746 males. So 4,884 in TG1 and 4,733 in TG2, and 129 that did not answer the sexual identity question. And about 2.5% of the male respondents in TG2 chose something else. So in this project, we only include results for males. So, okay, here is our data and substantive model of interest, which is Logit's model of illicit drug use in the past year as a function of sexual identity, of sexual identity to TG2. The trending set, you can just see it as benchmark set of estimates, because I just mentioned that originally I see TG2 as my population. So then we draw 500 bootstrap samples of the training set, TG2, and then we build a random forest to predict 4 sample and refer the 4 predicted probabilities for each case in the test set, which is TG1, the half sample with common 3 sexual identity categories, based on the random forest to a random uniform draw to impute 4 category sexual identity. And then we fit the substantive model of interest to that imputed data set and save the estimate. And we repeat steps 3 to 5 for each of the 500 bootstrap samples. Based on the distribution of estimates of the substantive model coefficients across the bootstrap samples, we want to see if we would make the same inference about the relationship of sexual identity to training data sets. So here, we can see the proof of the biases from the different sexual identity measurement styles, since TG1 and TG2 should be identical. So based on our prior work, the estimation of sexual identity with illicit use of drugs in the past year among males completely varies depending on how sexual identity is measured. And yeah, these 2 groups has So we leveraged the split ballot design in 2015 to 2019 NSFG data. So TG1 and TG2 should be identical, but here we see the difference. And that's why I say this is the proof of the biases from the different sexual identity measurement styles. Okay, so here we can see that adding the new estimates of health disparities between the original estimates based on TG1 and TG2 helps gauge the performance of our machine learning modeling exercise. So here you can see that the new intercept coefficient, which indicates the mean of the straight or heterosexual respondent, is the same as the original TG1 intercept coefficient, but it has a smaller standard error of of 0.02. So compared to 0.09 in the original estimate. And the estimated differences between something else and the heterosexual in the new TG1 and in TG2 are similar, with coefficients being 0.64. Oh my God. Sorry, I stayed up for studying for my midterm, so I'm now a little bit like absent-minded, but yeah, so okay, I have my curse here. So yeah, so with coefficient being 0.64 versus 0.87, and such difference in coefficient, given the standard errors, would not be statistically significant. So the coefficient for gay and bisexual both move in the right direction. I mean, right, because you remember I said I view TG2 as my population, so you can see as our population truth. So it's moved this in this way, like the coefficients for gay and bisexual both move in the right direction. That is, adding something else in TG1 reduces the original differences in health disparity between the original TG1 and TG2. The gay coefficient moves from 0.91 to 0.84. And the bisexual coefficient moves from 135 to 1.2. Though the discrepancies remain large, meaning there is still room for improvement in our machine learning model, but these results are encouraging. And this table shows how the sexual identities shift in TG1 in the respondent were given the something else option. So this is based on one bootstrap sample. 2.3% of heterosexuals, 4.2% of gays, and 8.3% of bisexuals would move to something else. And how accurate were the predictions based on the random forest? So we looked at the first few bootstrap samples, and the OOB error rates ranged from 2.96% to 3.11%. So pretty good. And predictions based on random forests are highly accurate. Quite some room to be improved. Are the right covariates being used in the model, or what would produce larger shifts in the right direction in the estimates? And are those who didn't answer their sexual identities something else? So if you have a good memory, you might remember that I mentioned there were 129 unknown cases. So we left out folks with missing data. We did list-wise deletion. And they may be respondents who feels that the available options didn't apply to them and making them something else in TG1. So here is the summary and future work. So our study provides a framework for retrospectively imputing additional sexual identity categories in surveys that did not measure them. And this will allow us to bridge different data sets and reveal what existed but was unobserved. In this sense, I am referring to omitted variable data, omitted variable or missing data problem. So such exercises may lead us to see a different picture of how individuals with an unusual sexual identity fare regarding not just health, but also a variety of other measures of well-being. So future work should figure out what would shift estimates even further in the correct direction. Thank you.
Thank you very much for a fantastic talk. Are there any questions
And
from?
also, there are some references. I need
Oh,
to
thank you.
give this great people credit. So,
Michael, I think first question, and
Yeah,
then if anyone else has any questions, please raise your hand and I'll call on you, Michael.
yeah. Thanks very much for the talk. Very interesting, very thought-provoking. I had, I guess, a comment, and I was wondering what your thoughts would be on that. So one thing about sexual identity is that it evolves over time, not well, in individuals sometimes as well, but also kind of just culturally, right? So people, come to identify by identities for which, there weren't words before. So that would mean that if you look at the samples from, later and earlier, which I believe is kind of what's happening, right? One variable that's happening is just time passing and just the cultural, the meaning of words evolves essentially. Kind of the culture changes as well. And you do see kind of changes in like the percentage of the population that identifies as gay, for example. So certainly some of that is going on. So I wonder if a different way to look at the data would be not kind of discovering an identity, which if you went back in time, maybe the person would not identify as such, just because that's not the vocabulary that they used. But rather just discovering the underlying factors that the random forest picks up that directly predict the outcome of interest, like I think you mentioned drug use.
Thank you for your sharing. And yeah, I totally agree with you. And I believe time would be a big confounding when it comes to the trend. I would say people would be more open-minded to different kind of sexual identities. But I would say in this project, I wouldn't say sexual identity is the main point. The main point is about the methodology part. So I would say the innovative part is that traditionally we would use one data set and randomly split them into two groups to do the machine learning thing. We will randomly split one data set into training data sets and test data sets. And the innovative part in this project is that we just leverage split ballot design to achieve that. Instead of split one data set into two, we directly use two data sets and they share the same concept. So yeah. And
thank you. Yeah,
thank
but I would say that kind of, I think what I'm, so if I understand the design correctly, I think what I'm saying kind of maybe in a way answers the question that you raised with respect to, well, the coefficients are not really that different, I think, but to the extent that they are different, it might just be, time passed, right?
Yeah, true.
Yeah, thank you very much.
Oh, sorry.
Thank you, Michael.
Are there any other questions from folks? Rona, in order to answer the question, oh, Annie, did you?
I have one, but you can go first.
No, no, please.
I was just going to ask if like either you or your colleagues or anyone is looking into a similar thing with gender options. It's interesting to me that you focus on sexuality because I feel like kind of like Michael brought up, like not only does it change a lot over time, but also like someone could shift sort of fluidly between labels within their life. And I think, you know, we look at gender as a predictor for lots of things in lots of different survey work being done on that.
Yeah, we didn't really look at the trend, and especially we only interviewed those subjects once. Like we didn't check them in 2015 and then check them again in 2019.
Mm-hmm.
So we didn't really know like what the trend is in a specific individual, and we didn't really separates each year to see if there's a trend like, okay, more and more something else people by time passing. But yeah, that would be interesting. But we look at sexual identity, but we didn't really look at gender. So there's a subtle difference. They would say gender is more of biological, but sexual identity is more of social construct. This is interesting because, in fact, I presented another paper, not really paper, it's a poster presentation at APOR this year in May. So we saw the different sexual identity measurement styles would cause the health disparity, which means you use a different way to ask about people's sexual identity will make them give a different response to your questions, especially to health related outcomes. And that makes sense because, like, for example, gay people might have more risk to get STDs. So like there are a lot of examples. So it makes sense to me. But what was interesting is that we noticed that this kind of health disparities existed only in those social related questions. So like that kind of health outcome or like risky sexual behavior or substance use or like their household size or if they want children or not. But this kind of difference didn't exist in like people's BMI or height or weight or all those things. So we can this might suggest that sexual identity is more of a social construct instead of biological reality. So yeah, I didn't know about the trend. I mean, by time passing, if people changed, but I think this is an interesting finding. So just share this with you.
Yeah, of course. Thank you. I guess I was thinking more of the like I think non-male or female, like genders as a social genders often get like we see as like political issues more and more, like it's becoming like a very politicized and contentious thing. And so I think I was just coming from that perspective of wondering if there's research being done on the survey and public health side of things. But what you're saying like totally makes sense.
Thank you, Annie. So my advisor just published a paper about that, about like policy and sexual identity. So yeah.
Oh, nice.
So his name is Brady West. Maybe you would be interested in this, research.
Awesome, thanks.
I'll just read out one from the chat. So EG asks, was there an option for prefer not to answer? And if there was that option, then do you have any insights from that?
It's refuse. So it will become the unknown cases because we won't know their sexual identity. Hi, Michael.
Hi. Oh, yeah. Sorry, I'm waiting for Rohan to call me, but yeah. So I had kind of another question that's kind of related to what I was saying before. Have you looked at the features that were predictive of
Yeah,
kind of the third option?
that's a good question. So as we are doing the selection of predictors is really important. So at first I'd like to do by variate correlation to check if the predictors I used are good enough. But first, yes, based on that. And second, we have a lot of prior work. So that's also a supportive, how do you say that? Supportive reason for me to choose those predictors.
Oh yeah, sorry. So I'm not asking about the ones that you didn't include, but more
Okay.
about the ones that you did, which were kind of the most predictive.
Most predictive. Wow. This might be hard to answer because there are a lot of like confundings and interactions between things. So I can hardly say which would be the only and best predictors. And conducting this kind of prediction, you will really need a lot of predictors. So
yeah, no, I mean, I think, and you know, like one thing that I had done in a similar project, I'm not saying that you should,
wow, that's
is
cool.
you just mask out, because like it is a random forest, right? But you can still just like mask out each feature in turn and just see how it affects. And well, I mean, you could just remove it and kind of see how that affects the predictive accuracy. What we had done rather is just the effect of if the features are all on the same scale, just like what is the effect of changing this from 0 to 1? What is the effect of changing this of 0 to 1? And that way, yes, like that doesn't account for correlations, of course, but it does give you an idea of kind of which features are important. The reason I'm asking that is I think, you know, kind of potentially if you have, in my opinion, I don't know, but in my opinion, if you have an outcome of interest, what you're and I recognize that you're presenting the method, but like you also presenting the problem, right? And to my mind, it's kind of, well, like you can predict the outcome of interest just directly from the features in principle, right? You don't have to go through predicting the survey response. And then you can just ask, okay, like presumably there are features or sets of features that affect both the outcome of interest and the response. And I think it would be just interesting to know what those are.
Well, so for the first questions, that was the reason why we also looked at OOB to check if we are like doing prediction effectively and efficiently. And the second part, so I think you were talking about we use illicit drug use as our outcome of interest. So we picked that simply because based on our prior work, that is something really related to sexual identity questions, measurement style. But you're right. There are a lot of different outcomes we can also look at. And
sorry. So that's not to clarify, not quite what I'm saying. Like I'm not criticizing. Like it's a fine thing to do, right? So what I'm saying is, one could imagine predicting, you know, your outcome of interest, predict kind of drug use from the original features, which you are plugging into the random forest, right? And then one might ask, okay, like some of those features are probably not super informative, but some of those features are. And it would be just interesting to me personally to know what those are and to also know whether those are the same features that predict the survey response. Because like one would assume, given the numbers that you presented, that the answer is yes, but it's hard to say.
Yeah, we are on the same page. So I didn't think it's you are criticizing this. So don't worry. I'm happy to receive those feedback. So what I was trying to say is, so yes, we want to look at more different outcomes, but we are not really answering this substantive questions. So I was not really measuring like people's illicit drug use and the relationship with their sexual identity. So we use the Logits model simply how bad our prediction is. So you apply the model to TG2, and then you apply the model to your imputed TG1. These two models, the relationship between these two models to see how good my prediction is. So the whole point is this is more of a methodological
totally.
But I appreciate that you care about substantive research questions. I would say that's really important. So my further goal is also to apply this method to some important questions, but now I am trying to develop a method.
I mean, illicit drug use is important.
Okay.
Anyway, thank you. Thanks very much.
Totally agree with you. And I saw Kelly.
We should probably just quickly go through. There's two in the chat, and then we should probably let you get to your midterm. So Kelly says, apart from healthcare, can the study be beneficial to any other domains? We've kind of touched on some of this.
So, I would say, because this, so sorry, I guess I didn't express this well enough. So we are dealing with the missing data or variable omitted problem. So imagine, for example, some usually people ask gender questions for only like male and female categories, but there are some transgenders, and biologically they might be a little bit different from this kind of binary way to categorize people. So for example, if you use only this binary way to ask about people's gender, and then when you want to see, for example, the mean of female and male's height, there might be more bias. And if you add one more category, which is transgender, and then you can reduce the biases. This is not just for health related outcome. You can apply this in anything. Like basically you just try to make your data more accurate. So it's not about health care, not just about healthcare or about anything. So yeah, this is more of a methodological paper. And we'll say, I'm curious about two aspects of the study. First, which categories were more likely to be reclassified as something else? And second, what was the objective function that you were feeding to when learning whether to reclassify someone? For example, were you taking their answers to the illicit drug use question into account when reclassifying? Okay, so we have the answer. So so it seems more bisexual people move to something else. In male, yeah, specifically in male. And because in this project we only look at male, but I will look at female afterwards. It's in our future work. And what was the objective function that you were feeding? So I use Logit's regression model. So again, I was not really majoring the outcome. I was use the Logit's model. I want to compare those coefficients to see if I am really successfully imputing the new sample I mean, how close it is to my population truth. That's the whole point of the way I conducted this.
On that note, we should probably just say thank you once again for a fantastic presentation, Rona. It's incredible work, and very much looking forward to seeing what you do next. And also, good luck for your midterm.
Oh, thank you. And I'm really happy to be here to share this project. And thank you all for your feedback. And feel free to email me. And yeah, let me know if there's something I didn't like make clear enough. I would really appreciate that. And
No,
thank you
deeply
all.
appreciate it. Thank you very much, Rona. Have a good
Thank
day,
you.
everyone.
You too.